The United States will purchase another 500 million COVID-19 vaccine doses from Pfizer. Those doses will be donated to low-income countries through USAID. Ellen Ogden is the Emergency Operations Center leader for the COVID-19 Vaccine Access and Delivery Unit at USAID. Ellen, welcome. Nice to have you.
Thank you for having me.
So tell me about the logistics of taking donated vaccines, delivering them overseas.
It's an incredibly complex effort. We work very closely with other countries to deliver vaccines, syringes, and all the supplies needed. We work with in-country Ministry of Health and other partners to develop good planning, training, and distribution systems. We're doing communications work to make sure people know where to get the vaccine and feel confident getting it.
I'm a little curious about, because the Pfizer vaccine has to stay very cold, and these are traveling long distances. How does that work?
So we use ultra-low cold chain equipment, and Pfizer in particular makes sure it gets to the country safely. And then there's an in-country system of ultra-low cold chain as well. And so it's handled from the airport to the facility, and then there's a protocol for delivering it out to the field. And there's good temperature monitoring as well.
There's a lot of low-income countries. How do you decide who gets it? How many do they get?
So right now we're working in over 125 countries. We really want to make sure that we're reducing morbidity and mortality in the most vulnerable populations in the world. And so the U.S. government's very generous in sharing what we have and our donations.
Well, speaking of that generosity, aside from saving lives, which of course is the #1 priority, I wonder if these donations are engendering goodwill among the populations. Are they seeing this as the United States is helping us?
Oh, they are. The demand for vaccine, especially the U.S. vaccines, Pfizer, Moderna, J&J, are really popular. And we're finding that people are lining up to get them. It's incredibly, it's a great thing to see, and people are so happy. There's arrivals, ceremonies, and there's a real sense of hope when they see the vaccine coming off and lining up to get it. It's really wonderful to see.
Tell me about some of the countries that you're delivering vaccines to. Don't tell me all 125,
No.
but just highlight a few.
So in Africa, we're providing vaccines to countries like Kenya, Ethiopia, DR Congo, Tanzania, Madagascar. Pretty much all countries in Africa are receiving it. In Asia as well. We're giving vaccine to Bangladesh, Nepal, Indonesia, Vietnam, the Philippines.
Wow.
Pretty much everywhere.
I mean, this is a huge undertaking. How big is your office? Is it well funded? How does that work?
We have a very small office, actually, and we're still getting up and running, but we have a great group of about 50 talented public health experts in immunization and supply chain, data management, communications, and behavior change. And we're all working as a team to support the countries where the vaccine is rolling out.
Are you tracking results? I mean, are you seeing, does your job end once the vaccine gets to the country, or are you saying, are those morbidity rates going down? Are infection rates going down? No,
we're tracking both. So we look at morbidity and mortality. We're tracking to see where you have vaccine and where you still have the virus circulating. We'll be able to identify hotspots, and we'll be able to identify the weak areas for vaccination, so we can go back in and make sure we boost coverage in those areas.
So I wonder how you can make sure that the vaccines are being distributed fairly and equitably. Once it gets to a country, obviously a lot of these countries are not democracies. They might not have good governance. How do you make sure that it's going to the people it needs to get to?
There is something that we work with. There's a national vaccine plan in every single country, and it identifies who the high-risk populations are. It identifies the facilities throughout the country where vaccine will be distributed. And we're working really hard to make sure that the vaccine moves throughout the country to what we call the last mile, and so that we're getting shots in arms for everybody that deserves it.
And Ellen, how do you have a goal in place? Are you saying we want to get X number of vaccines to X number of countries, or, do you have a timeline, for instance?
Well, President Biden has set a goal. So we're really aiming for 70% coverage by mid-2022, which is a very ambitious goal.
Wait, 70% of the world population?
Adult population, yes.
Wow.
It is a very ambitious goal, but one we think is important. And the coverage levels that we think are going to reduce the disease, reduce the emergence of variants, and really protect the population of the world and the United States.
Finally, I'm just wondering about how, just kind of some results that you've seen personally working on this program.
So far we've distributed 160 million doses of vaccine to over 70 countries. And it's very exciting when we get emails that say, oh, another batch was delivered, and you see how it's been received at the country level. We see people lining up. We see people saying thank you. You look on our embassy websites, and the people are just so pleased, saying thank you for bringing this vaccine to us.
It must be so gratifying to you personally. I mean, I could tell you're so excited about this.
I am. I mean, vaccines are a passion with me. I've been working in this area for almost 30 years, and to be part of this global effort to stop a disease like COVID-19 is really extraordinary. So I'm incredibly pleased to be working for government as a public servant and bringing the best of what the U.S. has to offer to other countries.
Well, Ellen, I appreciate your work, and thank you so much for being on the program.
My pleasure. Thank you for having me.